Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. Go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. Great study guide, great refresher if you're out in practice. Can definitely be useful for board exams and things of that nature as well. So simply an email will get you access to that, absolutely free. No cost to you. Again, reallifepharmacology.com. All right, the drugs that we're going to cover today are kind of some miscellaneous antidepressants, continuing on this theme of antidepressants. We've got Trazodone, Nefazodone, Vilazodone, and Vortioxetine. First, we're going to start with Trazodone. This is by far the most common of the three that you'll see in practice. Brand name is Desiril. Mechanistically, these drugs, most of these drugs are a little bit quirky in that they have kind of numerous actions that they have. So Trazodone has some serotonin antagonist and reuptake inhibitor action. That's generally what it's classified as. It blocks 5-HT2A and 5-HT2C receptors. Also has weak serotonin reuptake inhibition activity. But probably what makes it most unique, it's got some antihistamine action, so H1 receptor action, where it blocks those receptors, as well as alpha-1 adrenergic blocking receptors too. So if you know pharmacology well and understand what blocking those receptors does, you should be able to guess the adverse effect profile, which I'll get into down the road here. So indication with this medication, depression is its, FDA approved indication. Off-label, I probably see this more so used for insomnia. Occasionally, I'll see it used off-label for certain type of behaviors associated with dementia and things like that as well. But insomnia is by far probably the most common indication that I see it used for. The depression side of things, we've got to escalate dosages pretty high with this medication, 150 to 400 milligrams a day. That can increase the risk of adverse effects a little bit more. Compared to insomnia, the medication tends to be fairly sedating at lower dosages. And so, you may see anywhere from 12.5 to 100 milligrams at bedtime for the purpose of sedation and helping manage insomnia. So primary advantages, we've got helpful for patients with insomnia. So if you got somebody with insomnia and depression, you might have kind of a dual purpose there. Again, depression, you got to get to a little bit higher dosages, so that can be a little bit more challenging. Another potential advantage may have a little less incidence of sexual dysfunction, comparing it to SSRIs, for example. In the setting of insomnia, it is not a controlled substance, whereas, medications like Ambien and things like that, they are controlled substances with higher abuse potential. And again, inexpensive and generic options, so going to be pretty cheap that way. All right, side effects. Let's talk about this. So the antihistamine effects cause significant sedation. Okay, so that can be a good thing if we're treating insomnia, but it can be a bad thing if, patients are already too lethargic. We're probably not going to add Trazodone to treat depression. The other thing to pay attention to is orthostatic hypotension and dizziness. And again, this is more dose dependent, so the higher the dose, if you get to those antidepressant type dosages, patients could experience more orthostatic hypotension. And if you remember, the alpha-1 blocking action, that can lead to a drop in blood pressure. The other nuisance adverse effect that I see quite a bit is dry mouth with Trazodone, so pay attention to that a little bit. If you see saliva substitutes or a patient having, concerns or they're complaining of that, Trazodone is definitely kind of a notorious one there. And then kind of a rare one, but something that I've seen tested on board exams for sure is priapism. Again, not crazy common, but it is associated with this medication and definitely one that you should remember for drug-induced priapism. And then fall risk, on a lower level scale, I would say QTC prolongation and maybe serotonin syndrome. We could have some additive effects to those. But by and large, when you see this medication, when you see it at 100 milligrams or less, typically, and dosed at night, obviously, typically this medication is going to be used for insomnia-related purposes. From a monitoring standpoint, blood pressure, we're probably going to pay attention to that a little bit, and then obviously associated with that is dizziness and fall risk. All right, next medication is Nefazodone. This is formerly known as Trazodone, and it works pretty similarly to Trazodone. The reason why you do not see this medication used in the management of depression is it can cause liver toxicity. So, again, this is something I've definitely seen on board exams. Nefazodone can cause liver toxicity. The other big downside with this medication is it's got a lot of drug interactions by CYP3A4. So between those two things, the liver toxicity and the potential for drug interactions, that's really why you don't see this medication used hardly ever anymore. I've probably seen it in practice, maybe once or twice in the last, 5 to 7 years. And usually it's people that have been on it for a long time. So, again, fairly similar adverse effect profile to Trazodone, however, with the caveat of the liver toxicity risk, as well as the CYP3A4 inhibitor drug interaction risk too. All right, next medication is Vilazodone. This is a combo a little bit. It's got SSRI activity, but also acts as a 5-HT1A partial agonist. So it kind of combines the serotonin reuptake inhibition with some serotonin receptor modulation. Primary indication is depression with this medication. Titration, usually we get to 24 to 40 milligrams per day, increase it every 7 days or based upon, clinical tolerability and response there. One advantage, maybe compared to some of the SSRIs, again, kind of similar to Trazodone, maybe a little bit lower risk of sexual dysfunction. So, if you have somebody that's responded super, super well to an SSRI, and they're complaining about sexual impairment, and maybe mirtazapine, maybe bupropion doesn't seem like it's a good fit for that patient. That's where I've probably seen this medication, Vilazodone, used the most. Maybe tends to be a little bit weight neutral, where it's like, okay, maybe you saw some weight gain with paroxetine or mirtazapine. Maybe this plays a role in that type of situation. Common adverse effect profile, generally it's GI. So, some nausea, some diarrhea, stomach upset, vomiting, potentially even in more severe cases. Insomnia has been reported. Dizziness has been reported as well. Drug interaction-wise, CYP3A4 inhibitors may require dose adjustments, so pay attention to that a little bit. Other things to consider, we do have the serotonin syndrome risk, of course, and then that bleeding risk that's associated with SSRIs, could potentially be associated with this medication as well. On the downside, this medication is generally more expensive than many of the other cheap generic antidepressants. So that can certainly impact the use and selection of this medication. Before I get to the next medication and wrapping this up, let's take a quick break from our sponsor. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, NAPLEX, BCMTMS, or others, go check out meded101.com/store. We've got a ton of resources there that can help you pass your exam. If you're a nurse, med student or any other healthcare professional, we've got content available as well for you too. So again, all those links, meded101.com/store. Your purchases go directly to support this podcast, and I greatly appreciate it. All right, so finishing up, we're going to cover Vortioxetine. Brand name is Trintellix. And I'll always remind you guys, I've done a lot of these in the past. So if you go to the Real Life Pharmacology website and you search the specific drug you want, you're going to get, a full detailed rundown on some of the most important things with these medications individually. So Vortioxetine mechanistically is classified as a serotonin modulator and stimulator. It does inhibit serotonin reuptake. Also has action on multiple serotonin receptors. So it is a 5-HT1 agonist. It's 5-HT1B partial agonist, 5-HT3, 5-HT7, and 5-HT1D antagonist. Now, that is not something that I have memorized and committed to memory, and I would highly doubt you'd be asked that on a board exam or a pharmacology exam. But just keep in mind that we've got those multiple actions on different types of receptors there. Primary use is depression with this medication, usual dosing range 5 to 20 milligrams. One of the unique things about this medication that was seen in studies is it may improve some cognitive symptoms of depression in comparison to other agents. So if you've got a patient with a lot of those problems when they're depressed, difficulty thinking and, creating thought processes and things like that, that might be kind of a unique kind of target niche for this medication. The other thing, does have a generally little lower incidence of sexual dysfunction compared to kind of your standard SSRIs. Tends to be weight neutral, pretty minimal sedation. Obviously in rare patients you may see some sedation. Always something good to pay attention to whenever you start an antidepressant is, kind of the sedation versus activation, monitoring with that, with any new medication. Big disadvantage is cost, definitely more expensive. Common adverse effect profile, nausea, vomiting, some constipation has been reported, dizziness. I would say nausea is probably the number one adverse effect that you're going to see. As far as like interactions, warnings, serotonin syndrome risk, obviously, platelets, and NSAID anticoagulant risk, just like SSRIs. So paying attention for, excessive bleeding or bruising or something. This medication could mildly contribute to that. And then drug interactions wise, this is impacted by CYP2D6 medications. So CYP2D6 inhibitors, let's take bupropion for example, we may require a dose reduction with Vortioxetine. So pay attention to that if you've got any CYP2D6 inhibitors on board. Monitoring parameters, usually not too much, from a lab standpoint or anything like that. That nausea, that's the most common thing that's gonna pop up. Obviously, you're gonna monitor for mood and depressive symptoms, make sure they're improving. And then I alluded to the CYP2D6 drug interactions as well. All right, well, that's going to wrap up the podcast for today. If you enjoyed this episode, do me a huge favor. Share us with friends, colleagues, classmates, anyone who could benefit from some pharmacology education. Also, leave us a rating review on iTunes or whatever platform you're listening on. I greatly appreciate that. And, of course, support the sponsor, meded101.com/store. We've got tons of resources, crossword puzzle books, study guides, review courses, all sorts of different stuff at meded101.com/store that can help a whole host of different healthcare professionals learn pharmacology a little bit better. With that, I'm going to sign off. If you need to track me down, mededucation101 at gmail.com. Take care and hope you have a great rest of your day.